For more perspective on this bill and its impact, let's bring in Mike Archbol. He's the former CEO of GNC and a trustee at the Committee for Economic Development. Thanks very much for your time there. Now, this bill is called the Inflation Reduction Act. Of course, we will get to the elements like healthcare and climate change in a minute, but can you give us a broad overview as to how it's supposed to tackle exactly that, inflation, that is?
So thanks for having me, Sally. And it is very interesting because it is titled the Inflation Reduction Act, but it is more akin to being the Build Back Better or slimmed down version of the Build Back Better that has been talked about since President Biden was candidate Biden. So this is a long time coming, a big policy goal that they have had as an administration. And as part of it, they are also attempting to address inflation. So things that in this package that could actually impact inflation, as your reporting showed, was one, a reduction in prescription pricing. So allowing Medicare to actually negotiate some prescription pricing is one of the things that will help to bring down prices, as well as a number of energy credits and things like that consumers will be eligible for, as well as some of the investors that would be investing in green energy. So their hope is that would bring down the inflation rate. Of course, that is subject to interpretation, and there are a number of folks who have looked at this, nonpartisan groups, not the least of which is actually the Congressional Budget Office, which is their own assessment technique, that has said that it would have an inconsequential impact on inflation over the next several years. Nonetheless, it's still a big pillar and a big advancement for the Biden administration's policies.
Healthcare is a big ticket issue in this country, really, and of course it's no surprise that it's a big issue for this act. Can you explain for an international audience why this ability for Medicare to negotiate better with drug companies is so important for millions of Americans?
So there's a significant portion of Americans that are eligible for Medicare, which is those who are over 65, and then there's also those who are eligible for Medicaid, and those represent a very significant portion of those who are actually using prescription drugs. So the ability for Medicare to create leverage with the prescription drug companies is considered a big part of being able to drive down the costs.
If this deal passes, it would include the largest amount ever spent on climate change. Tell us about the measures aimed at reducing carbon emissions.
Right. So there are actually a number of investment tax credits, some of which are being extended, some of which are new. These allow for credits that companies will be able to take for investing in new technologies, solar, wind, et cetera. And those credits can range from anywhere from 10% to 30% of the investment. So those act as a very big incentive, basically creating some funding for the folks making these investments right up front, which enables them to actually get a better return. So one of the challenges that has been for the clean energy sector is the cost that it is to actually put it in place, and being able to bring down that cost is actually going to enable folks to make money over the long term.
All right, Mike, thanks very much for your insight there. Mike Archbold there for us.